Hello, hello, very nice to see you. My name is Leanna and I will be the provider conducting your HEENT exam today. It looks like we have you on the schedule just for the comprehensive screen. That's what brought you in. But just to confirm, you're not experiencing any concerns or symptoms related to your head, ears, eyes, nose, or throat. Just preventative exam today. Sounds good. All right. And then any insurance changes on file that we should be aware of? Okay. And we do need a secondary contact number if you're able to give that to me today. And who is that in relation to you? And it looks like we also don't have a pharmacy on file for you in the event that we do see something or ever need to send you a prescription in the future. Is there a pharmacy that you can provide for me today? Oh yeah, CVS. You said 8 Mile. And what city would that fall into? Okay. Yep, I see it here, so I will make that one your primary. Any changes to your home address at all? And can you confirm your date of birth? Perfect. As far as any medical conditions or prescription medications that you are currently taking right now, are you taking any? Okay. What about herbal supplements or vitamins? And how often are you taking that? Okay. Any history of any allergies? Zyrtec is needed. Okay. Just add that. Any surgeries to this general area? Head, ears, eyes, nose, or throat? Wisdom teeth removal. And when did you have that done? Okay. Anything else like tonsils, adenoids, anything like that? Okay, just making sure. And do you smoke at all? Cigarette, marijuana, vape, hookah, anything like that? What about alcohol use? Okay. Anyone around you smoke? Okay. All right. Let's see here. And it looks like everything else is up to date in the system. So the way we will start this examination is I am going to take your vital signs just to kind of start up your chart here. And then I will be performing an exam on your head, ears, eyes, nose, and throat. Basically this general vicinity. So you're not going to have to get undressed at all or anything like that. If at any point you're uncomfortable, please just let me know. And I'll just have a consent form here for you to sign after taking your vitals just to make sure you understand everything that's being done today, okay? Awesome. So I've checked you in. Let's get started with the blood pressure first, and then we'll do your temperature, and then we will get started with the examination. But do you have absolutely any questions at all? Lovely. Yeah, just, preventative appointments are always a lot less stressful, and if there is a problem, so just sit back and relax. That's what this ASMR clinic is all about. And if you have any questions, definitely let me know, okay? Absolutely. So I'm just going to have you rest both of your feet flat there, and I'm just going to put this around your arm for your blood pressure. Does that feel tight? Good. Okay. I'm gonna go quiet here. Just give me a second. pressure is normal. Great start. Do you see like a primary care? Okay. Have you seen one this year yet? Okay, good. Nice to hear. Yeah, most people usually start with primary cares and they'll see their specialist depending on like the findings and stuff. So that's awesome. Okay, let me just start a little chart here. All right. This is patient number 271. Okay, and blood pressure is normal. Okay, let's do a temperature check now. So this is actually a sublingual temperature. So this is going to actually get placed right underneath your tongue, okay? Awesome. Okay. This is just going to go right underneath your tongue. We're just going to wait for that to load a little bit. Temperature is good. Let me just grab an alcohol swab here to get this removed and cleaned up. Awesome. Nice and sanitized. Okay. Let me place that over there. Temperature is good to go. All right, so I am just going to have you sign right there. Yep, and that is for today's examination. Let me move my keyboard here, and then we will kind of get to the exam part, okay? So we have your ear. We always kind of like to draw just a general mapping so that if there are any abnormalities, we could always kind of point to where and the degree. Shorter hair. Okay. No obvious enlargements or anything that can be seen by general appearance, which is good. So we're actually going to start with your head. I'm going to put on a pair of gloves here, and I'm just going to do a scalp inspection, and then I'll probably just kind of take a pen light as well to get a closer look. But let's do that, okay? Give me 1 second. This glove is a little bit tricky. Okay, so I'm going to grab my pen light here. Awesome. Okay, so I am just going to examine your scalp, okay? Okay. Just kind of gonna look to the sides and at the top base. You haven't noticed any concerning like dandruff or lumps or anything, right? Okay. Just making sure, kind of split your hair there. Just kind of see those follicles. Make sure the base looks healthy. Okay. Okay, everything visually looks really good with the pen light. What I'm going to do is I'm so sorry, I'm going to knock you over. What I'm going to do is I'm just going to press on your scalp. Just to see if I feel anything. Because sometimes we won't always see it, but we could feel it. I'm going to kind of press on your forehead here. Okay, very good. Okay, that seems to be within the normal limits. Next thing I'm going to do is a facial inspection. So again, pen light comes out. Don't want to shine it too much in your face, but I just want to inspect the skin on your face. Again, just kind of general stuff behind each ear, neck. Okay. I'm going to press on your face here. You let me know if there's any pain. Sorry for those glove sounds. Any pain at your nose? Okay, what about your eyes? Close your eyes. Any pain? Okay. What about your cheek area? Okay. What about this ear when you press it? Okay, this ear. Your chin. Okay, I'm just going to assess for any lymph node enlargement. The throat area. The neck, I should say. Nothing swelling or inflamed, so that's good. Just open a press at the back of your head here. Okay, awesome. Next thing we're going to assess for is just sensation. So if you could close your eyes, just let me know when you feel something on your face. Good. 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 Mm-hmm. Next thing that you're going to be assessing for is vibration. So again, close your eyes. Let me know when you feel vibration and then when it stops. Good. Keep those eyes closed. Do you feel the vibration on one side more than the other, or do they seem pretty equal? That's awesome. Okay. Awesome, awesome. Next part of the exam is a quick visual examination. So I'm just going to have you look at me, and I just want to assess your pupils. Yep. Just kind of keep looking straight. Very good. Excellent. I'm going to take out one of my handy dandy charts here. Last page is what we need. Can you read the lowest line that you can with both eyes? Awesome. When was the last time you saw an eye doctor, by the way, just generally speaking? Gotcha. Okay. Well, now I'm going to have you do the same thing, but we're going to cover one of your eyes, okay? Yep. Read the lowest line that you can. Okay. I'm going to do it with the other eye now, okay? So we are all good to go with that. I'm going to take out my little scope here because I do want to assess red reflex. So you're just going to look straight behind me and I will do my thing here. There we go. Okay, ready? So just look behind me. Just assessing for reflex. Keep looking behind me. Okay, I'm going to take a closer look at both of your eyes. Make sure everything looks healthy. Okay. We are going to take off this attachment. And the next thing that I will be examining is your nose. Let's see. We'll put this size on for that. Okay. Again, I'm going to just turn on the light here. Alright. So if you wouldn't mind just kind of looking up. Just making sure your nails are painted. Okay, yeah, turbinates look healthy. Can you cover one nose? Breathe in, breathe out. This nose, breathe in, breathe out. It's just in there, not nose, but you know what I mean. Okay, going to switch the attachment one more time, and I'm going to take a quick look inside of your ears, okay? Okay, I'm going to take a quick look in your ears. You're just going to feel me pull back on this ear. Okay, tympanic membrane does look healthy. gonna pull back on this one. Very good. Yep, they both look great. Okay, we're actually gonna assess your hearing as well. So let me take this off and put this away. You are gonna close your eyes for me. Let me know when you hear a ringing sound and when it stops. So close your eyes. And what side did you hear that on? Good. Very good. Good job. Very good. You are passing this with flying colors. Let me just update everything regarding the appearance of the ears. And then eyes, nose. Okay, next thing is I just want to take some general measurements. Just gonna measure a few things here, so don't mind me. Or regarding your facial features, so we have it on record. And that would be my pencil also. Don't mind that. Very good. And then just two more things here. All right. Done with the measuring. The last thing that I need to do, where are my tongue depressors, is I have to take a quick look inside of the mouth and assess your teeth and all of that. So let me take a quick look with the pen light first, and then we'll do your oral exam. So if you wouldn't mind, I'm going to have you say, ah, open your mouth wide. Just going to feel a tongue depressor. Very good. No signs of infection. Gums look pretty healthy in there too. Okay, let me get rid of this. And then the other thing, before I take off my gloves, I usually leave this step for last anyway, so I did confirm that I got all that taken care of. Okay, I do just need to like palpate or press on the inside of your mouth, okay? So say, ah, any pain at the base of your teeth, no, upper teeth, no, okay, very good. You're all done with that exam. How are you feeling, okay? Yeah, no, you did great. It's definitely, it can be very quick, comprehensive, but at least stuff that normally, unless you have symptoms, people don't really look at it. You looked at it, so that's really good. So I am going to document all of the normal findings today. Like I said, I didn't see anything that was not normal. You passed with flying colors. I will make sure that there's a printed report for you at the check-in desk. And then other than that, you should be all set today. Yeah, absolutely not a problem at all. Do you have any questions at all? Awesome, all right. And look, when you first walked in, those girls will be able to give you a printed final report once I finish this, okay? Awesome, it was a pleasure seeing you today, and I hope you have a good one. See ya.